Hello everybody, welcome back to our series of NEET MDS 2021 Recall. In this video, we are going to see about an important lesion, that is neuroma, from oral and maxillofacial surgery. The question they have asked in previous exam was, they have given this image that is being shown here. So you can appreciate a lesion over here in this image. So of course, we have to identify what is the lesion. That is the question was. Patient with history of extraction of impacted mandibular third molar lying close to the inferior alveolar nerve, so this is the inferior alveolar nerve, develops lesion as shown in the radiograph. So the most probable diagnosis is, so the options given were neuroma, axonotomesis, Wallerian degeneration, and neuropraxia. So let us just see what is neuroma in this video. So Neuroma is a growth or tumor of nerve tissue. So neuromas is a growth of tumor of nerve tissue. Okay. So neuromas tend to be benign. So this is important. It is a benign tumor. It can arise from different types of nerve tissues, including the nerve fibers and their myelin sheath, as in the case of genuine neoplasms like ganglioneuromas and neuronemos. So in particular, traumatic neuroma results from trauma to a nerve, often during a surgical procedure. So during a surgical procedures, when we accidentally do a trauma to a nerve, then arises the traumatic neuroma. So the traumatic neuroma, so it is arising after a peripheral nerve transection. The proximal portion of the nerve generally forms sprouts. Okay, so in an effort to regain communication with severe distal components. What does this mean is, so we have a nerve like this, right? So when we are performing a procedure around this nerve, when it is accidentally cut, so what happens here? We'll be having a proximal segment and a distal segment, right? So what will happen? This proximal segment will form sprouts, means it will try to form a connection with the distal segment because it wants to get reunited with that. So when that sprouting occurs, what happens without distal communication? That means when this sprouting occurs but it has not connected with the distal end, then what happens? A stump of neuronal tissue, Schwann cells and other neural elements can form. So here a stump forms which is having neuronal tissue, Schwann cells and other neural elements. So this stump or neuroma can become sensitive to mechanical and chemical stimuli. Okay, so this is called as neuroma. So here forms the neuroma. The stump or neuroma can become sensitive to mechanical and chemical stimuli. So the pain the patient experiences shocking or burning like pain. It exhibits a positive Tinel sign. So what is a Tinel sign? So a Tinel sign is the result of a simple non-invasive test that checks for the nerve problem. So it is a simple non-invasive test that checks for the nerve problems. It involves tapping a finger along the problem nerve, as you can see in the image, which can produce tingling or pain. So if there is a nerve damage or a problem to the nerve, when we are tapping a finger like this, so what happens? So when we are tapping a finger like this, that finger will produce a tingling or pain sensation in the problematic nerve. Then traumatic neuroma in the lesion develops most commonly in the soft tissues of the mental foramen area. So the neuroma in the mandible develops in the mental foramen area, lower lip and tongue most commonly. Okay, but it also may develop in the third molar region during surgery of third molar because of the damage to mandibular or lingual nerve. Then coming back to the question. So here the question, in the question there is a surgery of third molar. So a lesion has formed in the inferior alveolar nerve, which is a branch of mandibular nerve, right? So the answer will be neuroma, which is there in the option A. If you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at Docshala for dental content and at Docshala Medical for medical content. And you can also find us on Telegram. Thank you.